You know, there's a question I want to read to you. This is from Caitlin Ma, who's a Columbia journalism student. In your plans to fund a new Department of Community Safety, you say you will transfer $605 million from existing programs into this new department. What would you cut from, is the question.
There would be no cuts to create this department, right? This is a department that would have a budget of about $1 billion, 605 existing programs like Be Heard, for example. The other $400 million would be from new revenue. And so if you look at our policy proposal, we put forward over the course of the primary a belief that the two most productive ways in which to raise that revenue would be, one, by raising the state's top corporate tax rate to match that of New Jersey, and two, by raising New York City's personal income tax rate on the top 1% by 2%. Those two things together raise $9 billion. There are a number of approaches we could take in city government that would raise an additional $1 billion. That $10 billion covers the cost of our major policy programs and starts to Trump-proof this city.
So $1 billion for the Department of Community Safety. What's the personnel size, roughly?
The personnel size, a lot of that is still to be determined in terms of the scale. Much of this is to ensure that this is what it would take to start to put it together. And about 2/3 of it is already existing, right? But it's about cohering it. 1/3 is to be created, most especially in the dedicated teams of mental health outreach workers in the subway station.
Yeah, walk us through that. A mental health crisis on a train platform, we've all seen it. It might be acute, or it might be, kind of a passive in a way where someone is just falling apart in front of the rest of us. Walk us through the response. What would that look like?
So you would have teams of 3. And in those teams, you would have an EMT, you would have a peer, because we've also seen time and time again that having a peer present in these interactions is critically important. And I'll give you an example of how this could work. In Denver, they had a STAR program. This is a program that focuses on low-level crime. And in the neighborhoods where they focused, that crime went down by 34%. Over the period of a number of years, they had 12,000 clinical interactions. Of those, only 3% required a medical hold. I say this because oftentimes in this conversation around subway safety, in the conversation around mental health, there also comes a question of involuntary commitment. And what I have said time and again is it's outcomes, it's evidence, and in reading some of the research around involuntary commitment, not being fully convinced that this actually has the outcomes that we hope that it would in terms of remedying this, but saying that this would be a last resort. However, the first resort has to be actually engaging and interacting. And the goal here is not just to respond to someone in a crisis or in need. The goal is also to bring them out of the subway system. In Philadelphia, they have a Hub for Hope program where they transformed some vacant spaces within the SEPTA system. And they were able to connect more than 300 previously homeless individuals to housing. My goal here is, how do we ensure that our approach to these crises is not just one of shifting people out of view, but actually connecting them with services? And I remember, I think it was in The City, there was an article that came out that showed this absurdity that we had nearly the same number of vacant supportive housing units as we did homeless New Yorkers.
Sure.
And how through this mix of bureaucracy, incompetence, and a lack of interest, there was a complete inability to match anywhere near half of those same New Yorkers with those services, to the extent that I think 3 of them died waiting to hear back on their application.
Sure. Would you agree with me that while it might seem simple and it's certainly frustrating and sort of morally unacceptable, it's also hard, right? I mean, you've got all these different agencies involved. There's the MTA and there's Department of Homeless Services. There might be this new Department of Community Safety all involved. Making it work is kind of the whole trick, right?
Absolutely. This is none of this is simple. None of it is going to be easy. But what has been so frustrating is it has seemed for many years as if there are many who are not even trying. They are simply at peace with a status quo that we know is broken for so many. And I am confident in our ability to actually deliver a new chapter. And I am running once again against Andrew Cuomo, and in this conversation around homelessness, we also can't forget this is a man who, in his cutting of the Advantage plan, that was a decision that led to a skyrocketing of homelessness here in New York City. So some of this is difficult, it's bureaucracy, it's managing these multiple agencies. Some of this is also the result of funding decisions that have been made that cut state funding and then by doing so cut matching federal funding and left us in a position where we have come to accept homelessness as a fact of life in New York City.